Could you, as a parent, be able to identify any early warning signs for cancer? Remember, in my last video I said early diagnosis saves lives. So these are 9 symptoms that every parent should know that will actually save your baby's life. The first sign I will start with, and it's a most common sign that parents usually present with their babies to the emergency department, is fever. And no, any fever is not really that bad. If your baby feels warm, sometimes it might be July and you've just put on 50 million clothes on them and they're genuinely feeling hot. But if you find that your baby is getting persistent fever and you have been going to the hospital, they've done tests, they've done they even checked your urine and are not seeing any signs of infection, then you should start being worried. Start asking yourself questions. What am I missing? If maybe you've been seen by in a dispensary or in a small clinic, go to a facility that has a registered pediatrician who can be able to go through these tests with you and even explain to you what those parameters mean. And just like fevers, another thing that can be confused with like an infection is when a patient is having persistent weight loss and persistent fatigue. So many infections can result in weight loss, especially something like tuberculosis that presents so much differently from babies and adults. We can do a series on tuberculosis later, but if you notice that baby is persistent weight loss, persistent fatigue, refusal to feed is always a big sign. The next danger sign is easy bruising and bleeding. That is different. A bruise is like the purplish, reddish discoloration that you can see under the skin, and bleeding is obviously you can see blood coming out. And for bleeding, it might, what is most common is maybe epistaxis, what we call nose bleeding, and gum bleeding, especially if your baby is now learning how to brush their teeth or is able to brush their teeth. You can notice those bruises and bleeding underneath the gums or overt bleeding. There's another sign that might not look as obvious to you, but it might look very obvious to a qualified doctor like myself. Something known as persistent bone pain. I'll give you a brief story. There's one time a patient came to our facility and we noted that this patient had been just complaining of bone pain. Unfortunately, by the time this patient was presenting, it had been bone pain that was ongoing for several months. And since we were able to identify this bone pain as a red flag, we were able to do some tests and we discovered that this baby had leukemia. Persistent bone pain is a sign of cancer. It might be a sign of bone cancer or even something like leukemia. It is very important not to ignore this bone pain. You will notice that the bone pains are mostly in the long bones, like the tibia, the fibula. So that is very important. Just make sure you get your baby checked. Another common symptom that is not normally associated with cancer are lymph nodes. And I agree, whenever we get any infection, you'll just notice the lymph node group adjacent or close to that infection might be swollen and even palpable. But did you know that lymphomas can actually mostly present with enlarged lymph nodes? Hence, this is not something you should ignore. Lymph nodes can occur anywhere, but the most common ones associated with lymphomas are usually the ones in the neck, above the clavicle. You could also have lymph nodes along the neck or in the armpits or the inguinal region, and some can actually just present in the inguinal region because when we're doing the staging, we look, is it below the diaphragm, is it above the diaphragm, and they give us different stages. A bonus point regarding lymph nodes, if you identify the dangers I have mentioned, persistent fevers, persistent weight loss and easy vertibility, and painless lymph nodes that are increasing in size and becoming more than one in number. They might be matted, meaning they seem like they are stuck together and they might not be able to move. Do not give your baby any form of steroids. And that is the reason I'm telling you, don't go to a clinic or a dispensary or a pharmacy and just get the over-the-counter medication. Go to a pediatric doctor because some of these steroids are used as part of treatment for the cancers, and by the time you're reaching to the pediatrician and you've used your steroids, you find that the lymph node has shrunk and we don't have any tissue sample to be able to give you a complete diagnosis. Hence, by the time the patient is presenting later, the cancer has spread.